in the number of cases, but overall staying relatively steady after a 13-week decline in cases. So we continue to monitor that data from a statewide perspective. We are still seeing decreased hospitalizations, as well as use of med-surg beds, ICU beds, and ventilators, and our COVID-like illness continues to remain low statewide. Again, here is our epi curve of the entire pandemic with important events and dates overlaid. You can see that the epi curve obviously shows the same thing as the cases per week, and you can see that we have reached a plateau here. We continue to monitor that, but we do place specific events over that we know will either contribute or play a role in either increasing or decreasing cases as we continue to monitor the progress. Here's our percent positivity. So percent positivity, for those that don't know, that's an indicator of community transmission. This is a little bit different than what's shown on the page of our laboratory on our dashboard. This shows the total number of tests that are being performed in Arizona. The dark part of the bars shows the number of unique patients that are getting tested. And then the gray bars are those tests that are being done in patients that have already been tested previously. And you can see that each week they account for approximately half of the total tests that are being run. We are seeing a plateauing and a little bit of an increase in our percent positivity. We continue to monitor that. We are below our 5%, which is where we would like to be for our community transmission. Moving on to vaccine distribution, we've had some updates this week. All of our counties are vaccinating age 16 or 18 and above. Pfizer has become more widely available with the addition of state pods around the state and more pharmacies that are administering Pfizer throughout the state. So Walgreens and CVS are able to take the Pfizer vaccine, but a lot of our pharmacies are also offering the Moderna. So you just need to check, especially if you are 16 or 17 years old, or you have a son or daughter or a family member that wants to get vaccinated who's in that age group. Currently, the only vaccine that's approved for that age group is the Pfizer vaccine. We continue to look at how we can push the Pfizer vaccine out into some of our rural counties so that those that are eligible can get vaccinated. Here is Arizona's vaccine allocation from throughout since about December when we first started receiving that. You can see that we did get an increase in the number of Pfizer doses that we received this week, as well as a slight increase in the number of Moderna doses that we received, because the Johnson & Johnson is currently paused, and we'll get to that in a little bit. We are not getting any doses allocated to Arizona for us to be able to order for this week, so we will keep you updated on that. But we've had a total of over 4.3 million doses allocated to Arizona. When you look at the total number of doses of vaccine administered, we've had 4,300,000 administered. We've had over 2.6 million Arizonans who have received at least one dose, and 1.8 million Arizonans who are fully vaccinated. So again, you're fully vaccinated if you've received 2 doses of either the Pfizer or Moderna, or if you've received 1 dose of the Johnson & Johnson vaccine. So the CDC and the FDA this week recommended a pause in Johnson & Johnson COVID-19 vaccine. And this was out of an abundance of caution. This pause was recommended after a very small number of individuals experienced a specific adverse event after the vaccination. These appear to be very, very rare. It's about 1 in 1 million. They occur within 2 to 3 weeks of vaccination. Keep in mind, it's a very small number. Over 6.8 million doses of Johnson & Johnson vaccine have been administered throughout the United States. On Wednesday, the CDC convened the Advisory Committee on Immunization Practices. That group is the one that makes the recommendations for vaccination for the United States. They reviewed the specific data of those cases. and determined that they'd like to see more data. They have decided to keep that pause ongoing, and they will reconvene either Thursday or Friday of next week. In accordance with the CDC and FDA recommendations, ADHS is recommending that our providers pause using the Johnson & Johnson vaccine. The extremely rare event was a very specific kind of blood clot called a cerebral venous sinus thrombosis, seen in combination with low platelets, or what's known as thrombocytopenia. And so what we are asking providers to do is to keep a low suspicion if they suspect a blood clot consistent with a CVST, that they take a platelet history or a platelet count, and that they ask for a history of vaccination status. We continue to work with our federal partners to identify, and what we are encouraging is if patients had a appointment to get a Johnson & Johnson vaccine, there are appointments currently available statewide to either get the Pfizer or the Moderna vaccine. We just released appointments today that there is still availability. And we would encourage them to get one of the other vaccines while the Johnson & Johnson vaccine is being paused. In Arizona, over 1,200 vaccine sites have received vaccine and the ancillary supplies. We continue to increase that. As we've said, over 1,500 long-term care facilities around the state have received vaccinations through the CDC Long-Term Care Pharmacy Partnership Program. And over 750 pharmacies have been receiving vaccine through the CDC Retail Pharmacy Partnership Program. And so that's been really good. That continues to increase as more vaccine becomes available through that program. And so our pharmacies, our community health centers, and our dialysis clinics are part of our statewide strategy to ensuring that we have a sustainable statewide vaccination program. So if you, if you are looking, you can find where pharmacies are that have vaccine at azdhs.gov/findvaccine. We are working with them. However, you do need to go to their pharmacy-specific website to schedule an appointment. I'll walk everybody through that. But the pharmacies that currently have vaccine through the federal retail pharmacy are Fry's, Albertsons, Safeway, Walgreens, CVS, Walmart, Costco, and Bash's Food City pharmacies. We've got 65 federally qualified health centers around the state that have been allocated vaccine through our federal partners, and we will continue to add more and more places where you can find vaccine as it becomes more plentiful. So almost all of our long-term care programs have completed the program, the CDC Long-Term Care Pharmacy Partnership Program. We are still waiting for final numbers, but nearly 137,000 doses of Moderna have been administered in this program to over 1,500 facilities. We really want to thank our partners, CVS and Walgreens, for their help with providing this prioritized population the vaccine, because this was a really high-risk, vulnerable population, and we want to make sure that we were keeping them safe and they were prioritized to receive vaccines as some of the first groups in Arizona. For those facilities that didn't register for the program, CVS and Walgreens do have additional resources available, and you can find that on their website. Or you can contact our licensing department. We do have the information here and can get you connected with CVS and Walgreens. As we continue to ramp up our vaccination capability, our state vaccination sites have administered over 1.2 million doses since January 11th. State Farm Stadium has administered over 750,000 of those doses. And I'm sure you're all aware we're transitioning to indoor sites so that we can continue to provide vaccines from the state perspective, but keep our patients and staff safe. Our Dexcom indoor drive-through, so that's the state's drive-through that is indoors. That opened on April 5th, and it's open from 7 a.m. to 9 p.m. We offer about 3,000 to 4,000 appointments per day, but it does have the capacity to do more. There are appointments available, so we release them every Friday. The other thing we would recommend is if you can't find them online, try the call center. If the call center doesn't have them, we do release additional appointments on a daily basis. So we would recommend checking back each day until you get an appointment. We opened our ASU Desert Financial Arena. So this is the indoor location that our Phoenix Municipal Stadium transferred to. That transitioned successfully indoors on April 12th. They are currently open from 7 a.m. to 5 p.m. and offer about 3,000 to 4,000 appointments per day. That is a walk-in clinic. So there is free parking at ASU just north of Desert Financial Arena. We do have golf carts for those individuals that may not be able to walk into the arena, but it is all indoors. You get to spend your 15 minutes or 30 minutes of observation and recovery in the arena in the chairs. So this continues to be a wonderful partnership with ASU and Arizona Complete Health, Walmart, and some of our other state partners. Next Friday, we will be transitioning our State Farm Stadium, which was our initial site, to Gila River Arena, which will be another walk-in indoor vaccination site. So our State Farm Stadium will continue offering vaccines until 9 a.m. on April 23rd, and then this will start up around noon on Friday, and then we'll continue. That will be 7 a.m. to 7 p.m. and we'll be indoors as well. And this is a continued partnership with our teams at the Arizona Cardinals, Arizona State University, Walgreens, the City of Glendale, and a lot of other state partners. So we are hoping that this will hit 1 million shots in May. And then on Thursday, we'll be welcoming our newest site, which is the Westworld Vaccination site. That will open Thursday, April 22nd. They will be open 7 a.m. to 5 p.m. That will also be a walk-up site and offer approximately 3,000 to 4,000 appointments per day. We are so excited about our partnership. We are bringing on some new partners with Cigna, the City of Scottsdale, and some of our other traditional state partners like the Department of Emergency and Military Affairs. Our U of A vaccination site continues to operate. They've been doing a fantastic job. We are looking to transition them. So they are a hybrid site right now. They have drive-in capabilities as well as walk-up capabilities. They are looking to transition potentially indoors based on what we expect the weather to do. But they are open 10 a.m. to 10 p.m. and offer over 4,000 appointments per day. We would recommend that anybody in Tucson who is looking for a vaccination, you can sign up. We've had appointments available every day at the University of Arizona, and we would encourage all of our Southern Arizona partners to take advantage of that. And then finally, our Yuma Civic Center vaccination site. Our pod transitioned to a state-supported pod on March 29th. Again, this is an indoor walk-up site. It's available 7 a.m. to 5 p.m., and this has been a really cool partnership with Yuma County, the City of Yuma, Yuma Regional Medical Center, and Arizona State University. On this site, this is another one that has had open appointments daily, and so if anybody is looking in the Southern Arizona region to get an appointment to get their Pfizer vaccine, we would recommend making an appointment there. On Monday, we will be opening our Northern Arizona University vaccination site, and so very excited about that. That site will be open 7 a.m. to 7 p.m. and will offer up to 8,000 appointments per week. This is in partnership with Coconino County, Northern Arizona University, Northern Arizona Healthcare, Premier Medical Group, and some other state partners, and we're very excited about expanding into the northern part of Arizona. This past weekend, we held our Ability 360 event. That was in partnership with Ability 360, Passport Health, the Arizona Commission for the Deaf and Hard of Hearing, the Special Olympics, and the ARC of Arizona. We were able to give first doses over 2 days in a familiar setting. Their second doses will be May 1st and 2nd. Over 1,600 Pfizer shots were completed over the first weekend. And we continue to identify ways to increase access and vaccine equity through our community-based vaccination events and our outreach. So our local allocator model, that's where we're using our experts in public health, our county health departments, to determine which providers they work with and distribute based on increasing vaccine equity at the local level. They continue to assess and make recommendations dependent on the needs of their communities. And so we've had several community-based and faith-based organizations partner with public health and healthcare providers to launch events. And we will be holding some teletown hall meetings, targeting some of those highly vulnerable areas, including districts, Phoenix City Council districts 6 and 7 on April 21st. And then one in Yuma on April 28th. That's the English version. We will also have Spanish teletown halls that will be available as well. Just to remind everybody, we do have appointments available on my brief check at all the pods when I walked out just a little bit ago of my office. So if anybody wants to learn how to make an appointment at a state pod, you can go to podvaccine.easyDHS.gov. You can go in there and schedule an appointment. If you need help learning how to register and or how to make an account and find an appointment, you can go to azhealth.gov/findvaccine. That will not only have all of the state pods where you can register, but it does have a list of all of the available providers who have been allocated vaccine. For those that don't have access to the internet, or for those that would prefer to work with a live person to help them schedule that appointment, they can call 844-542-8201. We do release separate appointments to our call centers so that they have available inventory. We also release appointments online and to our call centers every day. Our call centers are open 7 days a week from 8 a.m. to 5 p.m. If you'd like to make an appointment at a pharmacy, you can find a pharmacy location by going to azhealth.gov/findvaccine. That will take you to the specific location. If you click on the pin, it will show you the website where you can go to register. You can click on that. It will take you directly to the sites. But if you just want to go directly to the sites to find any pharmacy that has an available appointment, you can go directly to their sites and register. And again, the availability is going to be based on vaccine supplies and allocations. We have been working very closely over the last week or so to get the FEMA vaccination sites in Pima County. We were told last week that FEMA's legal counsel had notified them that they cannot work directly with the local health department, that they have to sign an agreement to the state. We are working both with FEMA to get the Arizona FEMA state plan amended and added to our state plan, and then we have been working on a contract between the state and Pima County, so to give them the responsibility to be able to uphold the FEMA requirements for site implementation. So we were able to meet with them and agree on contract language. The contract draft is currently pending with procurement, and we have a follow-up meeting with FEMA to see if they will accept the state FEMA Pima County contract terms. And then once those are signed, site implementation will follow. And with that, I'm happy to take any questions.
Hey, Dr. Chris, first up is Cameron Pollan.
Hi, Cameron.
Hi, Dr. Chris, can you hear me?
I can.
All right, so I guess the first thing I want to talk to you about is the CVSD that we're seeing from the Johnson & Johnson vaccine. Is there any indication that we're going to see this unpaused sooner than we think, just based on the low rate of this happening and what we see as an average rate in which we see this in our population with or without the vaccine? What do you think?
Right. So we anticipate it likely being unpaused relatively soon. What they said was that they had a significant number of individuals that in that age category that had been vaccinated within the last 2 weeks. So what they wanted to do was to take a pause, see if any more cases occur so that they can get more data to make clearer recommendations. But you're right, there is a threshold of blood clots in the general population, even when people aren't being vaccinated or taking medications. There are some medications that increase your risk of blood clots as well. And so really what they want to do is to be able to review as much data as they can. Obviously 6 cases are not that many. And so really to make some good recommendations, because they understand that this is an important tool in our battle against COVID-19.
Have we experienced anything of this sort that is currently being observed in our state?
So Arizona has not received a report of this type of incident. So especially like after Johnson & Johnson. So we continue to monitor. All of the adverse events are reported to CDC, the VAERS system, which is this shows that is working. They're picking up things that may have a signal and really following up on it to ensure the safety of the vaccine.
And my last question has to do with homebound folks. So the Johnson & Johnson played a big role in getting our homebound folks vaccinated. How are we going to offset that?
So what we're looking at doing is we're trying to identify providers that received Johnson & Johnson to identify. We certainly don't want people to have to cancel vaccination events. We don't want appointments to have to be canceled, especially if they're scheduled for some of those homebound or highly vulnerable individuals. And we're trying to replace the Johnson & Johnson vaccine with Pfizer and Moderna. So we're working very closely with our county health departments to see which providers need that type of vaccine.
Thank you so much.
You're welcome. Thank you.
Howie Fisher.
Hi, Howie.
Hi, is this not where I registered to get one of those 13 marijuana licenses?
No.
No, okay, well, that being the case, I've been looking at some of the trends in terms of vaccinations, and we seem to be plateauing and falling off. We only have 25.2% of the state that's fully vaccinated. You can talk to us about herd immunity. I realize some of this is outreach to communities, but it seems like Arizonans have reached almost a saturation point where they're not interested anymore. What are we doing about that?
So you're going to see our messaging start to change. And this is where we start to hit phase 2, potentially phase 3, where the supply is starting to meet the demand. And so you're going to see us now really starting to get more into the community about messaging about specific, reasons that people may be vaccine hesitant, working with community leaders to get those messages out about the importance of vaccine. We know that there's vaccine hesitancy. We know that some people are taking, they may not be vaccine hesitant, but they kind of want to see what's happening, to get that message out that it is safe, it is effective, and really work to get into the community. And then the other thing that, you'll start to see as we get more vaccine into the state are more of those community-based pop-ups. And so, I was at one this past weekend. They did a great job. I got the chance to talk to some of the community leaders, but really reducing the barriers of transportation. Those that may not feel comfortable going to a mass vaccination site, but would feel comfortable if it was at by a trusted healthcare provider. And then as they get more vaccine, the federal partners will open up that ordering so that healthcare providers will just be able to order it like they do all the other vaccines. So it will also become available in medical providers' offices. And we do know that our medical providers play a large role in people trusting and getting vaccinated. So if they can say, I've got the vaccine, I recommend that you get it, here's the reasons it's safe, and we can just get it to you today. Again, that reduces barriers and gives our healthcare community more opportunities to vaccinate. So that'll be on the horizon as well.
Which gets into something else. I did a little bit of study about what they're doing in Philadelphia.
Yeah.
Because of issues of people getting online and even with phones, they've opened up a lot of strictly walk-in places. They've saved like 50% for people who just, hey, you can just go down to place X. I don't see a lot of that here. Why aren't we doing more of that, particularly in saying, okay, we're gonna have a spot in South Phoenix or South Tucson or wherever, and at your convenience, you can just walk in. Why aren't we doing more of that?
So you'll start to see that happening. That's a great point, Howie. So that's something that we're talking with our pods about as the demand goes down. So like the University of Arizona and Yuma are those two pods. We've seen a significant decrease in the appointments filling there. So they are going to start looking at taking in walk-ins, just letting people come in and get the vaccine whenever they are available, not based on an appointment. So you'll see more and more of that happening as we start to see the demand in our Phoenix metropolitan as well. And then some of those community pop-ups, as they become more available, those will be walk-ins as well.
Okay, just two more things.
Yeah.
Gets back to my herd immunity question. We're at 25.2% of Arizonans that are fully immunized right now. We're not even getting close to the point of herd immunity. We are now in the middle of April. I realize on one hand, you can say we've only started this since January 11th. On the other hand, we're at the point where people should be starting to look at maybe the third dose, and I'll talk to you about that in a second. Are we ever going to get to herd immunity, or is this just sort of a pipe dream here?
We're going to continue to working towards that. Keep in mind that those numbers are using a denominator of the 7.3 million Arizonans. And if you think that we've got about 1.8 million that are 18 and above, it's actually a little bit better when you look at the eligible population. Now, with the fully immunized individuals, some of those people are going to have, they still have 3 weeks, because we did have a big push a couple of weeks ago where we significantly increased the vaccine. So a lot of that will clear up in the next few weeks. But we know we're going to have work to do to get to herd immunity.
Okay, and then, which leads to the other thing that Pfizer this week started talking about a third shot and then perhaps an annual booster. You're still trying to get people to get the first and second shots in their arm. Talk to us about this issue of needing a third shot, at least with Pfizer. J&J is who knows what, and I don't know where Moderna stands on that. But talk to us about this whole issue of the third shot.
Yeah, so what we're evaluating is how long how long the vaccines are going to give you immunity for. So we know that they're good for about 6 weeks, and they continue to monitor to see the effectiveness of the vaccine and how long that lasts. There may need to be a booster in order to make sure that you remain immune. We continue to watch that. What we would hope is by the time people would need a potential booster, that we will have enough vaccine to where it's in healthcare providers' offices, that it's in all of the pharmacies across the state, and it would just become a normal routine thing, just like your annual flu shot. And so we continue to evaluate and see if that's something that we will need pods for, or if that's something that the community will be able to pick up moving forward.
Okay, I just want to check the number. You said, I heard you say that we know the vaccines are good for 6 weeks. Did you mean 6 weeks or 6 months?
I'm sorry, Howie. No, I meant 6 months. That's a great catch. Thank you. I apologize.
Okay, I don't want to have to go back every 6 weeks.
No, I don't either.
Okay.
I don't either.
Okay. Thank you.
Welcome.
Okay, Peter?
Hi, Peter.
Good afternoon, Dr. Chris. A few follow-ups to the J&J. So you said that this task force, I forget the name you said, reviewing it through next Thursday and Friday because that's the next time they'll meet.
Yeah.
So if they give the clearance then to unpause, I mean, you didn't give a specific time that they could unpause, you just said soon. If they unpause by next Thursday or Friday, how soon would more doses be produced again? And then how soon after that would it take for them to reach Arizona?
Yeah. So that's a great question. So, when we got that notification, and I'm sorry, the days all blur together. I think that was Tuesday. So most of our doses get shipped to Arizona Monday or Tuesday. And what we asked providers to do was just to put a note on it, maintain the cold storage with a note that says, do not, put on hold, do not administer, but keep it good. So What we would anticipate is that a lot of those doses could just come out. It was about 12,000 doses that we received in Arizona this week. If doses became available, if they unpaused it, our normal ordering cycle is Thursday and Friday. And then we place that order on Friday, and then the doses come in Monday and Tuesday and Wednesday. So it would be a pretty quick turnaround that we'd be able to get those doses back out, but there would already be doses in the community that providers could start using immediately upon it being unpaused.
So could new doses that are not in Arizona, could they be produced and brought and shipped out perhaps over a weekend, or would it take a little longer than that?
Yeah, usually, so they're usually shipping them out over the weekend with us getting them, like, I think we either get like our Pfizer on Monday and Tuesday when we place the order on Friday. So it would be a very similar shipping schedule.
Okay. Another subject, how many of the 298 confirmed breakthrough cases have been hospitalized or even died? And has that number increased? These are the 298 people that took the shot and caught COVID again.
Yeah, you know, I'd have to go back. We can get you those specific numbers. I don't have those off the top of my head. I apologize.
Anecdotally, do you think that they were hospitalized, they got really sick, or no one or give no information?
I'd have to check. I don't have a lot of information. I know the team's been monitoring, but let me make sure I get you the correct and accurate information.
Sounds good. And one more thing, FEMA and Pima County, what's the contract looking like? I know it's still, the details are very quiet, I'm sure, at this point, but
Yeah.
would this mean that your department would have control of the vaccines and the personnel because of this? What kind of controls would the state have? What kind of controls would FEMA or even Pima County have in staffing, in vaccination, storage, et cetera, et cetera?
So what the contract does is basically delegate all authority to Pima County. So Pima County would be responsible for the operations, the setup, the tear down of that, and give them the authority to work directly with FEMA. So we would be delegating all of that responsibility to our partners in Pima County.
Would the shot allocation, the vaccine allocation already coming to Arizona, would that change? Would that FEMA hold on to the vaccines, or Pima County hold on to the vaccines, or do they get more? As part of the whole state pool?
Yeah, so what we understand is the state will continue to receive our allocation. This does not come out of our allocation is what we've been promised. This would be an additional 6,000 doses that would come as a federal allocation directly to these pod sites. So it would be additional vaccine is what we're told to those sites.
Very well. I think that's it for me. Thank you.
Thank you, Peter.
Okay, next up is Colleen.
Hi, Colleen.
Hey, Dr. Christ, how are you?
I'm good. How are you today?
Doing well, thank you. Hey, wanted to follow up on Monday. I know you said had about 18,000 appointments they had left over. Did those get filled this week, and how many are left now from that 11 a.m. prompt today?
I will say the Phoenix metropolitan ones were all full by Wednesday. But we still had a number of appointments available at our Yuma and our U of A pod site. Right now, it was tens of thousands of appointments were available when I walked out of my office around 1:45. But we can get you that exact number after this. We'll have our team pull it and get you those numbers.
Yeah, no problem. And then with having, obviously, taking time to fill those appointments, and I think Howie kind of talked about this with you a little bit. But kind of what does that tell you about where we are as a state in terms of vaccine uptake? And I know you talked about kind of how your guys' strategy and messaging is going to start to shift, but maybe just kind of where you think we stand then on trying to get shots in the arm.
Yeah, so I think that what this shows us is that the supply is starting to reach the initial demand. Those people that were going to, come at 2:00 in the morning to get the vaccine. What we kind of noticed with last week's allocations, the last appointments in the Phoenix metropolitan area were in the middle of the night. So people are able to become more choosy. Like, they know that if they wait another week, they might have a better appointment time. So we are starting to see that, but it does tell us that people are also able to get vaccine in other places. which is all a really, really great sign. We hope, though, that we continue to fill the appointments in the Phoenix metropolitan area. We are watching demand. Appointments for our Westworld and our Gila River should have gone live today as well, unless there was some issue with it. So, you know, we continue to add sites and additional locations. So it'll be interesting to see what those additional daytime appointments, what they do to the demand as well. But we're monitoring it on a daily basis.
Sure, and I know, I think it was Monday you had said you're thinking these state things will probably stay open through May and June. Is that kind of what you're thinking now still?
Yeah, so that's what we're looking at right now. You know, we continue to monitor. If demand all of a sudden went up a whole bunch, you know, in the middle of May and people were scrambling to get appointments, we might keep it open longer. Or if that happened in June, you know, every day that we administer first doses, we know we're still in the business for at least 3 weeks after that, because we want to make sure that everyone gets the opportunity to get that second dose of Pfizer. But we do continue to monitor. We had actually had potential other sites that we were looking at bringing on as state-operated pods that we've kind of paused right now because we're seeing that, you know, we're kind of hitting the supply meeting the demand.
Sure, and then one other question for you. I saw the White House announced today that a little under 4.9 million will be coming to the state in early May to boost genome sequencing. To help track the variants. Obviously, I know this was announced like a couple of hours ago, but how is the state planning to use that money, you know, to monitor the pandemic going forward? And how will that kind of help when we talk about, you know, the third dose of people needing the vaccine? I know there's potential that, you know, they can kind of tweak the vaccine, if you will, to kind of help cover those variants should it pose the problem. Obviously, we know that doesn't pose a problem right now.
Yeah, absolutely. So, you know, we've heard that this money is coming. We have contracts with partners that do some of the genetic sequencing work for us, but we can also do genetic sequencing here at the Public Health State Laboratory. And so likely what we would do is continue to fund those partners to either do more samples or to continue the work that they're doing for us. You know, we are randomly sampling some like people who test positive. Those are coming. We're doing the sequencing so that we can track what variants we are seeing in the community here in the department or through the department, so that we can, you know, keep an eye on what those recommendations should be and if there are any concerns.
Okay,
Thank you so much. Have a good weekend.
You too.
Steve Jess.
Hi, Steve.
Hello, Dr. Christ. Pima County has distributed a copy of the proposed intergovernmental agreement covering the FEMA vaccination site, and some Pima County officials have described it as a little harsh or even draconian. I'm looking specifically at the requirements that says Pima County has to create its own registration system, and it can't utilize any system similar to one created or utilized by the state. Why would a requirement like that be necessary?
Absolutely. So, you know, we did talk through all of the conditions yesterday, and we're able to come to agreements on language for the conditions. I think, you know, when you look at the vaccine management system, FEMA has very specific requirements. So when you say that the contract is draconian, a lot of it was just taken from what FEMA expects the state to sign on to. We just replaced state with Pima County in a lot of that language. When you look at the vaccine management system, it actually doesn't necessarily, there's a couple of things that don't comply with what FEMA wants us to be able to provide. So it wants us to take away the opportunity for people to defer answering some of those questions. We do give people the opportunity to defer if they're not comfortable or if they don't know. And so that's one thing, but the onboarding and the deployment of that for a state pod site is a significant workload on the department, and with us bringing on 2 brand new sites over the next week or so and having to transition those, we don't have the resources to support the onboarding or the the ongoing maintenance for an additional site. So that was one of the reasons, but that was in the letter that we actually had sent on the 26th to FEMA, that Pima County had already agreed to, that they wouldn't use that registration system. Was that all from Steve?
One other question.
Okay.
When do you expect do you have any idea when this FEMA managed site is, or the sites rather, are going to be up and running?
So I know that they're trying to get it before the end of April, and so that's what we're trying to work for. There were some changes yesterday that Pima County requested that we have to see if FEMA will agree. So one of them was FEMA requires all of the data, which to be provided in an aggregate, de-identified manner within 1 day. Pima County has asked us to ask FEMA if that could be extended to 3 days. There was also another, they wanted to be able to use half of the doses that were provided in a mobile manner. FEMA only allows a third of that. So there's a couple of things that we have to see if we can negotiate with FEMA on behalf of Pima County. So that may take a little bit, but we're hoping by the beginning of May.
Thank you.
You're welcome.
And also in Tucson, Alexander.
Hi, Alexander. I don't hear you.
Hi.
Oh, there you are.
I'm right here. Just head down mute real quick. My question is in regards to the J&J vaccine. So if the J&J vaccine was used to reach some vulnerable populations, how might this pause uniquely affect these populations? For example, are you worried that they could be experiencing more stress while the very few cases that caused the pause are investigated, or are you worried that they might have reduced access to a COVID-19 vaccine for a while? But how might this pause uniquely affect vulnerable populations that were suited very well to receive the J&J vaccine?
Yeah, it's a great question, because the Johnson & Johnson vaccine definitely had some benefits for reaching vulnerable communities or rural communities. You know, what we had prioritized it for here in Arizona really was like populations that were going to be more difficult to get that second dose to. That could be whether they lived rural, whether we knew that they had a transient like occupation, so they may not still be here in Arizona. And so that does, your second concern that you've said is a concern for us in public health. It could be a barrier for them to get it. Now, what we're trying to do is replace all of the providers with Moderna or Pfizer so that they don't have to miss any opportunities this week of getting people vaccinated. But it places a barrier for getting that second dose so that they're fully vaccinated. And that's always a concern. And I think when anybody hears about a potential side effect, especially with a side effect that could have very significant or severe outcomes, I think that adds a level of stress to anybody who may have received the vaccine. And so, you know, that's why this was done out of an abundance of caution. It was a signal that they picked up through the routine monitoring, which is showing that the system is working. But it is, you know, it's been 6 reported cases so far out of 6.8 million doses administered. So it's about a 1 in 1 million chance right now based on the data that we have. I know that they want to get more, but what we would tell people is if they've gotten the Johnson & Johnson vaccine, and if you're experiencing any of those symptoms, you know, please talk to your healthcare provider. It's a very specific syndrome. And we're working with healthcare providers to make sure that they know how to treat it successfully.
So how long do you think this delay will be to replace J&J vaccines with Moderna, for example, or Pfizer? In Pima County at El Rio, this week they had to stop a program to vaccinate with J&J, vaccinate transient, I think, homeless populations, for example.
We're hoping it's not going to be very long. You know, what we would hope is that maybe they'd get back together. This is the best case scenario, that on Thursday or Friday they review the data and they determine that it's okay to unpause. That would be the best case scenario. It's really hard to predict with some of these clinical outcomes because keep in mind, these came through as adverse event reports. Now we're asking providers to be extra on the lookout for this, so they probably will receive more reports of people who may not have this specific syndrome, but may, have something similar or a different type of blood clot. So that's going to increase the signal. So sometimes it's a little hard to tell, exactly or predict what's going to happen. But we would hope best case scenario, they would unpause it next week.
Okay, thank you very much.
You're welcome.
Next is Christina Durant.
Hi, Christina.
Hi, Dr. Chris. So my question is kind of taking back off of what Howie and what I believe Alexandra just said. So addressing vaccine hesitancy, how do you think the J&J big pause kind of affected that? And what are you doing moving forward specifically for that? And also not just for J&J, but do you think it also affected the other vaccines?
Right. So that's our worry. We want everyone to understand that we have not seen that same issue with the Moderna or the Pfizer vaccine. So there is no pause on that. We would recommend that you keep appointments if you've got them for Moderna or Pfizer. And if you had a Johnson & Johnson, please reschedule for a Moderna or Pfizer dose. There are plenty of appointments available right now around the state. That is a concern, and it's always a concern with, with our vaccine hesitant populations, especially of those that are concerned that they would be one of the ones that would have those outcomes. Again, these are significantly rare events that have occurred. The system is doing exactly what it's supposed to do and pick up those signals, do further research, and make more refined recommendations. And so ACIP is doing that in partnership with the FDA. But, it does scare people. We're hoping that people have seen that millions of Arizonans have been vaccinated safely and effectively here in Arizona. And would, we would recommend you talk to your healthcare provider, you talk to somebody you trust who has gotten the vaccine, so that you can hear what their experience has been with it, because I think that instills a lot of confidence in people. We've got a lot of information on our website. You can always go to azdhs.gov or the cdc.gov to get accurate information about the vaccines.
I'm not sure if you would know or how much J&J vaccine is out there currently after the pause that's being unused.
We can get you the data on how many doses have been allocated to Arizona and how many have been administered in Arizona. I don't have those numbers off the top of my head, but Steve can follow up with you and get you those numbers.
Thank you.
You're welcome.
Okay, Kiara.
Hi.
Hi, how are you?
I'm good. How are you today?
I'm doing good. So I just read an article that said an eighth of Arizona nursing homes have less than a week's supply of PPE, and a fifth are low on staff. And I know the AARP president in Arizona is asking the state to allocate more resources to nursing homes, as well as releasing more data about nursing homes into the public. Is that something that the state is working on?
I would have to see the article. I've been involved in other activities today. I do know that if nursing homes or long-term care facilities, such as an assisted living facility, if they need PPE, what they should do is contact their county health department. PPE is not, most of it is widely available, so they should be able to order it, but we do have supplies through public health. If the local county health department isn't able to provide some of that PPE, we can always supply it at the state, from the state level, but it is widely available, so we would recommend checking with the manufacturers. I have not heard the staffing thing, but I can double check with my team and see what's going on.
Okay, and is there anything in the works to release more public information about what's going on inside nursing homes?
All of our publicly available data is available on our website at azdhs.gov. I don't right now foresee us releasing additional information.
Okay, thank you so much.
You're welcome.
Stephanie Ennis.
Hi, Stephanie.
Hi, Dr. Chris. I just have a few questions for you. One is about the surge line. What is happening with that right now? Is that, I know it was only supposed to be for a year, so is it gone now?
No, we're continuing the surge line, just because, we're still in the process of vaccinating Arizonans. We wanted to be able to maintain some of those efficiencies that the surge line provides, especially if we get increased cases. So the surge line is still operating. It's actually one of those things that we've identified as a best practice to see how we can either keep it going as a service to some of our hospitals, or how do we be able to stand it up again quickly if needed for a different pandemic in the future. So we are taking a look at that, but it is still operating right now.
Okay, great. And then just on the breakthrough cases, so I wasn't aware. So we've had 298 of those 5,800 that were reported nationally.
I would
that
have.
Was in Arizona.
I know that we did release some data on the number of cases that are breakthroughs. So the breakthrough cases are those that have received vaccine and then diagnosed with COVID. I would have to get into the specifics on that. We know that I don't know what was released nationally, and some states may not be reporting like as quickly as we are. So I'd have to go back and look at that data. We know that no vaccine is 100% effective, so we anticipated that there would be some breakthrough cases, but the team is monitoring that, and Steve can get you the data that we have on that.
Yeah, thanks. I just wondered if any of those breakthroughs, I mean, do any of them have to do with the variants at all, or is it more just that no vaccine is 100% effective and you would expect some cases? Could it be both?
I think it could be both. We do know that the vaccines are still effective against the variants that we are seeing. But it could just be that, we know that we've given a lot of the vaccines. We know that no vaccine is 100%. I don't know that we're seeing one variant come out more than others. At least that hasn't been brought to my attention. My team may be monitoring something like that, but we can get you that information.
Great, thanks so much.
Yeah, absolutely.
Next is Carissa.
Hi, Carissa.
Hi, Dr. Chris. My question is about the $65 million in federal funding that's heading our way from the rescue plan to expand access to vaccine. Can you explain how that money is going to be used? Could it potentially be used to pay staff? Is it going to be available for all pods?
Yeah, absolutely. So there's a lot of different groups of money that are coming down. The one I think you're asking about is the $65 million to promote health equity among vaccination, right? Like to promote those vulnerable groups. So a lot of that does have to go to our local partners to be able to ensure health equity. So things like we would be looking at getting that out to our county health departments, and to getting it to working with immunizers who can go out into communities to provide some of those pop-up vaccination events. Some of it does actually have to be used on staff. So they have specific positions that they want the health department to hire that look at health equity. So like one of them is a data analyst that looks at health equity. I think another one is a vaccine, like health equity coordinator. So there are specific requirements that we have to meet, and then a certain percentage that needs to go out to the community directly.
Great, thank you.
You're welcome.
And our last question is from Allison Steinbach.
Hi, Allison.
Hi, Dr. Chris. Thanks so much for taking our questions.
Yeah.
So I just had a quick question about the Northern Arizona pod. I was wondering if you could talk a bit about sort of what went into the decision to open a pod there when it looks like rates in Coconino County are pretty good compared to a lot of different places in the state.
Yeah, Coconino County has done a phenomenal job, and so their rates are good, just like you pointed out. We actually have been working with them for several months to bring this pod online. It was something that they were interested in doing and getting some of the support for that. And so, we continue to provide support to those partners. It does provide an additional point up north so that people don't need to come down to the central part of the state to get vaccinated if they want. And so we will continue to monitor. I think they're another one that are looking at implementing just walk-in appointments as well, in addition to in addition to people who have pre-scheduled appointments, because they are doing pretty well with their vaccination rates.
Got it, thanks.
You're welcome.
Okay, Dr. Chris, that's all the questions. Thank you everyone for joining us and have a great weekend.
Thank you.